what other misconception out there is now, because it's not over. People are still catching this disease and whatever drugs are out there. But so what are still the misconceptions that are out there about this disease?
The misconception still exists that it is a gay disease, or for those who are in the LGBTQIA community, that you could get it by behaviors that are unsavory, where there are different ways to acquire HIV. There are people who were perinatally infected with HIV, nothing that they did within their behavior. So when you have those misconceptions, you then are blaming someone for a way that they acquired this disease, and that's shaming, and that's a stigma, and that follows them all the way through. It's also a misconception that it's not treated. Medicine has far advanced now, where we can work with someone who is newly identified as HIV, and then they get on medications, stay on medications, and they can become virally suppressed, which means that the level of virus in their blood is so low that they can't transmit as long as they are taking their medications.
Are you ready for the...
Welcome back, y'all. We are back in the studio, and we have the wonderful Peta-Gaye with us. Hi, Peta-Gaye. I'm going to say your full name because, we're friends from, college, but I'm going to say your full name with respect because Miss Tomlinson, you are doing your thing. I am so proud of you.
Thank you so much. Longtime friend, yes.
Yes. So let me give you a bio a little bit. So today's guest, Peta-Gaye Tomlinson, a dynamic public health administrator, quality improvement expert, and media consultant with over 18 years of experience, born in Jamaica, hey, and raised in New York. Peta-Gaye is a proud first-generation college graduate, holding a bachelor's in psychology and a master's in organizational leadership from the University of St. Joe's. Go Blue Jays!
Yes.
Her career in public health began with supporting women and children at emergency shelters, connecting them to vital services like vaccination, mental health care, and STD screening. She later worked with the Community Health Center Association of Connecticut, collaborating with states and federal organizations to advance STD, STI prevention, Medicaid, and HIV/AIDS services, a testament to her commitment to improving community health. Currently, Peta-Gaye serves as a project manager for the City of Hartford, Hartford's Department of Health, where she oversees a $5 million health. Okay, let's fix that. A $5 million, I got to put a dollar, most people know it says dollars, okay? Health system program benefiting underserved population across 3 counties. In addition, as chief consultant of Always a Production LLC, she leverages her expertise in media and storytelling to build authentic brand identities for Black and Brown communities. Hello, my sister.
Yes, I'm ready.
I'm ready, right? You're doing your thing. I am so proud of you. It's just amazing to see where people's journey started and where they ended up, and see how God has just carried them through, when you're determined to have a dream. It's amazing. So I want to know, let's just get in there. Why do you think we are not hearing as much, because this is your area, about HIV/AIDS epidemic as we once did? Because I remember back in the 90s, it was everywhere, billboards, commercials, everything. But now I feel like it's like, I don't hear about it. I've said those 1 or 2 commercials to see on TV. So what's going on?
So I think some of the bigger things around maybe the lack of education or visibility with HIV and AIDS is the messaging, right? Just like you said, there is more so a focus on the commercials that, again, and speaking to our community, we tend to not see ourselves in those communities or in those commercials. That we feel left out in the messaging. So speaking directly to that point, messaging is important. I think one of the other things, if we get deeper into it, is that for the most part, we've been silenced around education, sex education in schools. I know within my journey, it's been a battle just to get schools to say yes to certain conversations. I remember going back to my own high school, specifically, we had to have a special meeting with parents because talking to high school kids about sex was so taboo and crazy. And when we had to give them literally statistics, I went to Bloomfield High, so I'm just be transparent with that, that the statistics of Bloomfield High for STI infections was higher than that of Hartford, right?
Wow.
So when we laid those statistics out, we're saying, you want to shut us out, but we're trying to have preventative conversations. Your students are having sex. They're seeing sex like it's happening. So we can't baby uh preteens that are sexual beings. Let's call it what it is. And so we had to basically really promise to adhere to certain conversations, but it's been a fight to get into schools to even talk at the levels that we need to. And so we've had to have different strategies um, to get at certain communities, specifically when it comes to the youth. But going back to just conversations around HIV and AIDS, again, I think one, there is misconceptions that it no longer exists. So, the scare tactics of yesterday or yesteryear um are where there myths still exist, but those scare tactics of
Everyone is dying.
everyone's dying and all of that, people have those conversations have lessened a bit. They still exist, but because people are living longer. And we could talk about that a little bit more too, but I think messaging is important. I think for me, in my world, I work in public health. Yeah, it's all around me, but if you're not in my world, yeah, you don't see the conversations happening where that is part of my whole, I feel like, my purpose. Where I was a young mom, sex ed, sex conversations, those were taboo. So having those table talk conversations, kitchen table, finding someone that you're safe to have these conversations with, those are things that I encourage even in my own family, starting with my own family. But I've often also been open to talking with, different kind of groups of just how to talk to your teen or be a safe space for them to come to talk to you about sex. So there's so many levels to it right now.
So yeah, so as you mentioned before, there's a misconception that is still, a deadly disease. Because back in the day, we used to hear, "Oh my goodness, you catch this, your life is over." That's how
Yeah,
dramatic it was. That's what I believe. I'm
yeah,
like, if you catch this, your life is done. You can't have relationships. You won't be able to have a
yeah,
family. All this kind
yeah.
of stuff. So, what other misconception out there is now? Because it's not over. People are still catching this disease, and whatever drugs are out there. But so, what are the misconceptions that are out there about this disease?
The misconception still exists that it is a gay disease, or for those who are in the LGBTQIA community, that you could get it by behaviors that are unsavory, where there are different ways to acquire HIV. There are people who were perinatally infected with HIV, nothing that they did within their behavior. So when you have those misconceptions, you then are blaming someone for a way that they acquired this disease, and that's shaming, and that's a stigma, and that follows them all the way through. It's also a misconception that it's not treated. Medicine has far advanced now, where we can work with someone who is newly identified as HIV, and then they get on medications, stay on medications, and they can become virally suppressed, which means that the level of virus in their blood is so low that they can't transmit as long as they are taking their medications. So HIV is treatable. It's also preventable. So our prevention efforts are as much as we try to have prevention more high than we do treatment. But yeah, HIV is now treatable. It's not curable yet, Though there have been a few instances in our world where some folks have been cured of HIV through specific treatments to cancer or some other research studies. But again, those are small numbers. But again, it's treatable, not curable, and you can live longer.
So what steps, since we're not getting the education you think we need to get, and we do need this education still. And I don't think, because when I was growing up in Bridgeport, sex ed was in 5th grade. And they don't talk about STDs in sex ed. They don't do that.
So with the changes in administration over the years, it's been interesting to know what schools are able to talk about. And again, depending on where you are in the country, specifically in the South, the southern states tend to focus more on abstinence only curriculum. That's not realistic. But with legislation being different in different states, that's just what in the realm of what they can talk about. So you might have a surface level of education where again, consent forms need to be signed and so on and so forth. However, legally in certain states, at the age of 13, teenagers can go to like their nurse's office and have certain conversations and certain things given to them. So there are some schools, if they're allowed to, based on their state or their school council, can provide condoms. But again, it depends on the jurisdiction.
So what should people be doing to protect their health?
What people should absolutely do to protect their health is get regular testing. I can't emphasize that enough. If you are sexually active, you and your partner should be testing at least 6 months. At least 6 months. You can do it much more frequency than that. There are window periods, so it's very important to also understand how window periods work. So you could probably do your testing 6 months, but there may not be enough if you have acquired anything. I'm not just talking HIV here. Any STIs, chlamydia, gonorrhea, may not be enough of it in your blood at the point where you go get tested that it becomes available on tests. So there are window periods where you might just need to know that you might need to go to talk to your doctor and ask for the test. I just also want to state that in the state of Connecticut, routine testing has become legal. So state routine testing, no matter what the point of entry, hospitals, health centers, you name it, they are required by law to offer you an HIV test. A lot of people may not know that. And again, I'm working with the state, part of a statewide collaborative to basically educate private doctors, hospitals, health centers about the fact that this exists. Legislation could go forward and it's just a matter of now marketing needs to reach the masses of what they need to know about what they need to do. So there's toolkits out there that educate medical professionals about this routine testing. So routine testing for sure.
Is
It's
it free? I'm sorry, is it free?
So there are locations. That's a great question. HIV testing is free depending on, again, where your point of entry is, your insurance. If you don't have insurance, again, you can get a free test. With the City of Hartford, um, and with my program, it's federally funded, but there are programs across the country that also fund or provide funding for health centers, hospitals, whatever outreach to do HIV testing. You can find that online, free HIV testing. There are also tests that you could buy in the stores or in the your CVS, your Walgreens or whatever, which are home tests that you would do the test at home and you can send it to the lab too. Just again, depending on your comfort level, there's a ton of ways that you can test. Again, I think one of the major things that I found has been a barrier is the conversations people feel like they are not ready for to either talk to their doctors about, or even some doctors have their own biases about how they even talk to their clients. So you know, and again, we've learned that in medical school, HIV, AIDS, and those things are not required for too long in medical school. They could get a few courses and just continue all in their medical schooling program, and they could leave that all behind. But we are really happy for those who, journey into infectious disease and are working within our communities to educate people and pour into the research and care and treatment of HIV and AIDS. So
Okay, so you said to get testing. How about married couples? Should they get tested regularly as well? Married couples?
absolutely.
Can you
So,
tell me what you're seeing?
so because I work my office is legit in the STD clinic area of the health department. When people come in to test, and we're really happy they come in to test, there have been situations, and not only at the health department, because again, I'm part of a statewide network of professionals that work with individuals all across the country. Also, not only in our state, but we have heard, because we do pay attention to trending data, that there are couples that, because people have to keep it real. Some relationships are not your nuclear mom, dad, children. Some relationships are different. And that's okay, right? You can have multiple partners and be in long-term marriages, long-term relationships, and they call it ethical. What is it? Ethical non-monogamy. Again, where you might have, it's okay to have multiple partners within your relationship. And if that's the case, that's the case, and that's people's business. I think one thing that people, and this is a touchy subject because people are like, I'm married, so I don't need to. But again, realities are that life happens. People are human, and just like, for any routine things that you might have to go check once you reach a certain age, it could be to check your breasts for breast cancer. The men with prostate cancer, I think HIV, AIDS, STIs should be also routine conversations as well in medical care. I think if we continue to have those as just routine conversations, we remove the stigma of acquiring STI or HIV. It won't be a stigmatized thing. It would just be a natural thing to talk about with your doctor or your loved one and say, hey, let's just go to the doctor. I started a campaign years ago, where I really emphasize, like, especially around Valentine's Day, that uh, uh, going on a date to the clinic is also really nice.
I like
Going on a
that.
date, especially for, you're on the apps, you're dating or whatever, and it's possibly getting serious, is getting to the point where you're thinking about intimacy, going to the clinic and just being sure that everyone is healthy. Because, what I want to make sure I emphasize is that I never focus on risk conversations more than I talk about how sexual health more so is self-love, if you think about it, right? So just like if you go to the doctor just to make sure that everything is good with you, same thing with going to your OBGYN or whomever for any other things that you go to. I think we need to normalize that, going to the doctor because I have whatever, it is problematic. I think we should routine have a routine in thinking about our sexual health as part of our overall health, and that if you
Mm,
are intimate with your partner, that is okay. We are sexual beings, and sexual beings need to be healthy in order to be optimal in their sex lives, and that's okay. That's really
okay.
where the conversation should lie. It shouldn't be around risk and, oh my God, it's scary. It should really be, overall health is self-love. Overall health. Just like if feeling down, with seasonal depression or whatever, anxiety, you go to see a mental health provider, right? That's not really, well, mental health in some ways is stigmatized, but again, is people are warming up to the idea on a grander scale about going to see a mental health provider. Should be kind of same thing with when we're talking about sexual health.
Um, sure, I like that. Before this, you mentioned that people can send in kits, take a test, self test at home, and send it in. If that comes back, if that's positive, does the provider call you personally, have that conversation with you versus sending that result back home in an envelope and giving you that shock? Like, how do you get that message delivered?
So in Connecticut, because I can really only speak to Connecticut, is when you send that test in, it goes to a state lab. So the lab, or there are mechanisms in place within our state where you will get contacted by someone that works within the state lab, or
Mm.
some organization that is trained, we hope properly trained, because I'm not even going to tell you it's a mechanism that is so efficient that you'd love it. But training is great for every area of our lives, right? Every professional individual should be engaged in some kind of training, but there are mechanisms in place that when it goes to the state lab and there is a positive, there is a chain of communications that happen, and so they will reach, if there's contact information available, they will reach out to the individual who sent in the test to the lab, and they would be informed to maybe schedule a meeting to discuss their results. And again, we have people who are trained to have these conversations about what happens, and even being prepared for the person's reaction. You can't always be prepared for every reaction, but most times with what our professionals see is that people tend to take tests if they have some kind of concern. If
Mm.
they had a weekend, it was kind of wild, they had fun, they probably don't remember, but they feel like there's that thing that's making me think I should go take a test. Oftentimes that's what's happening. And sometimes people hear through the grapevine, again, people live different lives, that they hear that they participated in certain parties or went to certain areas where someone may have tested positive. Again, that might trigger a need to go take a test. So,
So, oh, thank you. That's very good to know that that exists, and you won't be alone if something
and
should
just
happen.
additional to that is that there's also mechanisms that if someone tests positive, they can anonymously notify partners that they've been with. So the
Okay.
state also has a program that it's called partner services. So, they would take as much information from the person and
Mm.
say, can you name within this time frame or whomever that you may have been in contact with, and they would anonymously reach out to those individuals. Their name, of course, will not be used. It will just be someone that you may have been in contact with, just like contact tracing for COVID. Someone you may have been in contact with was recently diagnosed, and we're urging you to test. You could come in, schedule, and that kind of mechanism
Mm.
exists.
So, what got you involved in this work, and what drives your mission, in public health? What got you so passionate about it,
So
which
I
is
love
very
to tell
important.
this. So I love to tell this story because it literally started with my first job outside of graduating with St. Joe's. I worked at literally the name of the organization is called My Sister's Place. It was a 501(c)(3) organization, and part of that organization, they provided transitional housing to those who have issues with maintaining their housing. But there was also a shelter, a 90-day shelter for women and children, and I was a case manager at that shelter. And one of my clients at that time was actually connected through the program that I now run for the City of Hartford. She was connected to the Ryan White program. Now, the Ryan White program is this whole health system that works with individuals who have acquired HIV or are at risk. So they provide a holistic approach to medical care. So housing, transportation, food, you name it, child care. medical care. So that individual had a case manager in that Ryan White program who was looking for them because they were on a list to receive housing through their Ryan White program, and they couldn't find them. And so they said, look through the hospitals, look through the shelters, and she was located through the shelter where I was the case manager. So when they called me, I became part of now her care team, where they wanted to know in the last 90 days or however what was on her care plan with us, because we were trying to get her housing, not knowing anything about them. And so when I heard about this Ryan White HIV/AIDS program, again, we had to sign forms and all of that legal stuff. And so and she also had mental health, unaddressed mental health concerns. So she was not medicated. So there was a whole lot of things. So when I was became part of her holistic care team, because she was housed with us, and so we had to work all together to transition her to this housing program. That's how I got connected with Ryan. So that was 2005. In 2007, because I got so like, this Ryan White thing sounds amazing. They house people, they give childcare. I started also going to programs and learning a little bit more. And so when I saw a job opportunity for a Ryan White program manager at another agency, I took it. So I was with that agency, Community Health Center Association, for about 2.5 years or so. And while I was there, again, building my network, meeting new people, and just like, wow, I was traveling across the country, learning more, developing professionally. And just like, I really like this work. It's like impactful work. It's not that I'm clocking in and paying a check up, paying bills. I'm working along people who are passionate, they're advocates, they're wanting to help other people come into care and stay in care. They're people who had previous substance use issues or still dealing with their addiction, but they're also helping people to get tested for HIV and come in and stay on their medication. I'm like, this world is amazing. So someone tried to steal me while I was at my other agency work. Someone from the City of Hartford was like, I need you to come on my team. And I told her no at the time, and then things just happened, and I ended up at the city. I'm going on 15 years at the city, and my network has expanded. I say all the time how amazing it is that my worlds collide. My church got involved with partnerships with the health department and talking about HIV. We actually even did a curriculum with the youth at our church, talking about HIV, sexual health. And I'm like, all of my worlds collide, even socially. When I go out, I don't go to the clubs. I go to events, but I'm able to also connect with people in spaces that are like, come do this training, or what do we talk about, what do you do? And they're like, come do this training, come do this. Like, we're here now, we're on a podcast, right? And
Yes,
I'm able to talk about everything I'm doing. So like, all of my worlds over the past few years have,
yes.
have just merged, and I think that's nothing but God.
Absolutely. I feel the same way with my financial coaching and financial education. Everywhere I go and talking to people and in my church, educating the community, it's very important to see your work being influential, impacting people in a changeful way, right?
Yeah.
So yeah, I love it. So with that said, I know that professional side of you. Come on, tell me your migration story. How did you end up in Connecticut?
So I was born in Montego Bay, Jamaica. I was in Jamaica for not too long as a baby. My mom left the country to come to the States to get established, so she could bring me over. So I came over from Jamaica when I was 4. I did go back every summer until I was about maybe 12 or 13. But then there was a period of about 15 years I didn't go back to Jamaica, and that was way too long now as an adult when I look back. So I was in New York. And then it really was where we were living. Schooling was terrible in the 90s. It was terrible, and I had aunts, cousins here in Connecticut, and my aunt is an educator, so she told my mom, send her. She can stay. She could go to school. And honestly, I was a D student in Brooklyn, New York, because We didn't have books, or if we had books, the pages were ripped out. Teachers were overwhelmed. The system was overwhelmed. And so I came here, and turns out I was an honor roll student.
Wow, look at that.
Right.
Change your environment does a lot. I tell people to environment.
Absolutely. So changed and honor roll student, and it was like, wow, okay, I really actually do really like school. I actually also like the social aspect of school too. And so that became me staying, going on to college, and it was like, all right, well, I'm here. After college, it was like, all right, well, a few years into my career, I'm like, I kind of want to move to DC, but God wouldn't have it.
And
So
then you missed the most important piece. You met this wonderful Jamaican, right? Named
yes,
Petra.
absolutely. We created our own community on a
Yes.
college campus that did not have a lot of people that looked like us. We probably could count ourselves. We were probably less than a right. We had a great community of Caribbean people that we found our way. We
We
found each
found,
other and found our way on a
I
campus
know.
that did not cater to our needs. Food, socially, yeah. So, but yeah, I will credit the school though. I didn't realize how much work I would be doing with women and children as the focus, and I do believe that St. Joe's really empowered me
Yes.
more as a
Yes.
woman to take up space in all areas that
Yes.
I say that I should exist in. So I walk
Absolutely.
boldly in being an empowered woman. I do credit St. Well, now University of St. Joseph,
Joseph. Yeah.
for that.
Absolutely. I absolutely 100% agree. I see other females in different roles and they're like shrinking. And when I walk in, going to All Women's College, we just
Yeah,
show up. Our teachers, we're so emboldened. So I really appreciate going to All Women's College. But
yeah.
I'm glad to know your little story. How do you stay connected to your roots? You know, how's your
I
upbringing as a Jamaican shape you today?
How do I stay connected? Well, here's a great story. When you are Jamaican, you can't disconnect. Well, not in my family. My mom has been here in this country over 50 years, and you would think that she had just left Jamaica. The accent is strong. The food, just how we live, is just, it's even how, like, in New, because she never moved to Connecticut. She's always been in New York. Even how she lives, and just when I would go back home and see how, like, my aunts and grandparents, they live in community, like real community. My grandparents had 11 children, and it was a lot of food to cook. We lived on acres of land. My grandfather was a farmer. We had our own goats, we had our own horses, we had our chickens,
Yeah.
we had our all of that. And so they would cook big food, and they could still feed people that stop by, right? That's how my mom still lives her life. She lives by
Yeah.
herself. Well, not really. She has tenants, but they live like communities. She cooked food, she fry her fish on Friday, everybody can eat. She make
Does
her
she cook
soup,
soup on Saturday? No, she cooks soup on
everybody
Saturday.
everybody can eat. So her meals are like Thanksgiving most days, because again, they live in community. Her tenants above her, they all go to the same, well, above her and below her, they all go to the same church, right?
There you
So
go.
they worship together, they eat. Like, she's in Jamaica now because she lives part of the year in Jamaica, and then of course in the States. But so I really can't be disconnected from Jamaica. And actually, once I turned 30, I went back to Jamaica as a tourist, and I would sneak into the country. Nobody knows, because I don't want to go. I don't want to go where I normally been going, which is to
In the
the
country,
countryside.
in the countryside.
To the countryside. When I was 30 years old, it was my first time, as I can remember, because I don't think this happened. First time flying into Kingston. Now, Kingston Airport is not Montego Airport, and that's okay. But the environment in which I was able to enjoy Jamaica in the city life, I didn't know existed.
Mm.
I didn't know Jamaica had, paved roads and toll roads. I didn't know that there were all these kind of different restaurants from different countries. I ate the best Italian, the best Chinese, the best, you name it. I had it on the city side of the country, right? I went to because my best friends are they're in production, and they're with the bureaucrats, so I'm able to see how how the other side lives. And I
Mm-hmm.
liked it, and I was just like, when I would go to the countryside, that was simply it. I would live country life, and I love that too, but I never got to understand the other side, the business side, um some of the like even the political side of Jamaica that you hear about, but I actually got to talk to politicians and different, like, people who do tell the news or write the news, or do different, or in advertising, or are in entertainment, and just see how amazing it would be if I just had some money and be like, I'm leaving the country. I can live amazing in Jamaica.
Okay, okay. On that same vein, let's talk about some wealth here. Okay, let's talk about
Okay,
wealth. How are
right.
you building your wealth so you can go live that amazing life in Jamdong? How are you building that wealth?
So one thing I learned is that I am a hustler, and I never thought that I had that in me.
Really? As a
I
Jamaican?
didn't.
Really?
I didn't. I know. I didn't. So I will say that I believe that I had a limiting mindset.
Mm,
um I had a very limiting mindset, and that was due to so many different factors, right? I think one of the things was I believe that for a while I lived in a scarcity mindset where you hoard because you don't think anything else is coming. I think the other thing too is I didn't realize, or as I grew spiritually, I understood how my provision isn't made by me.
mm-mm, mm-mm, mm-mm.
So, with understanding that there's so many other things that I could put my hand in, or put my mind to, or put my passions in, I knew that, okay, there are more things to do than go to work. Um, my passions and purpose gratefully aligned. And so, diversifying how I invest, or just thinking different about how money should work for you. um and my mom did a great thing in introducing me to advisor years ago, a financial advisor, just to talk about different things about how money should work for you. So that was one of the greatest things she ever did.
Mm. So would you say you manage your money well? Like your budget, you save, you spend. Do you think you're
So
doing a
here's
good
the
job
thing,
with that? Mm-hmm.
I can do a much better job with not spending. But what I have learned, because I call myself my own safety net. I've always played it safe when it comes to, yeah, and I raised my son the same way. When it comes to saving and paying yourself, after you get you get your pay or whatever, and setting yourself up really to think about not just now, but what
Mm.
happens if,
Mhm.
you know? So I do spend, and I do play nice, but I have a nice savings.
Good.
So I know that my investment first is me. Um, and we talk about that with too. So like, even when he went away to college, he was able to go away with a lot of savings, not needing to work, just focusing on school. And that's not something I was afforded, right? So
No,
a lot.
no.
Right. At St. Joe stressing like, how I'm gonna get this loan. Because again, I am my safety net, and that has still carried me through in my thinking, and just being not scarcity mindset, but just
Yeah.
saying, there needs to be a rainy day fund in case, um,
Mm-hmm.
or there needs to be investment in cushion in case, I get sick or whatever. Because I did get sick during COVID. You know what I'm saying? Or I even saw my mom had a unknown illness that took away her ability to walk for about a period of 10 days. The doctors all now still don't know what that is. But because she invested in, specific like healthcare cushions, she was good. So there's so many things that are involved now as a matured adult, in my thinking with money, um, in safety net, in investments that I didn't have. Like I wasn't taught those things. Because again, my mom she was hustling to get by, but there wasn't conversations about how to properly invest, or I learned those in my adult years.
So when you're younger, just going back to that phase of your life, you keep mentioning that a sense of scarcity, you don't have that anymore. What was your impression of what money was? Like, was it lacking? You didn't see it? Because even though parents don't talk to us, we have a sense of, right, as young kids. And what was your feeling around money in your family?
So the thing was, when I was younger, I didn't know we were poor. I'll say that. As Caribbean people, I think you could look the richest, you could look like the richest person and have $2 in your account. I never knew that we were poor. I'll say that. And I think there was a lot about just being able to do a lot with a little that taught me as well about how to just maneuver when it comes to how we should live with money. Um I think too, when again graduating college, I wasn't making no money, and the loan people needed to be paid. I was also a young mom on my own, and again, I've been on my own since I was 17 years old. And I have never had to go back home, never had to call mom, or there is no dad to call to help pay a bill. God is the greatest. But I think it also is that I had to remind myself that I am my own safety net. Oh, God is the provider. He has never let me fall. And so I could say that, that scarcity mindset is released. I know abundance is around me, especially when I lead with intention of
Mm,
that my purpose is servanthood,
mhm.
right? I am not led by money. Um, and I think even with how you serve people, you are blessed in many ways.
Mm.
Um, and when it's whether it's financial or health or whatever it is, I think the way in which you approach your purpose does aid in how you are blessed with finances or whatever. And I
I
believe that
agree.
because I made certain decisions on, again, I do believe money is good. Money's good. It also can lead you down paths of, if you focus too much on that, um, I do believe that there could be some troublesome things there. However, um, money is good.
Let's
Making
repeat
money
it.
is good. Making money is good, having nice things is good, taking vacations is good, but
Yeah.
I also didn't realize when people were like, "Oh, you gotta save for the when you get old." Yeah, I'm now 40 something. I'm like, just 20, you know?
Yeah.
So just now taking serious about investments for retirement, because who knows what Social Security or whatever it is gonna look like, you know?
Yeah,
Um,
absolutely, absolutely. So, what are your streams? How are you making money now? I know you work, you work, so you get out your W-2. So, do you have any other streams of money coming in?
Yeah, so I have multiple streams through consulting. So I have some consulting projects through Yale School of Medicine, or some other schools in Chicago, where I consult and I train, do professional development with healthcare professionals. I also am a podcast host, so that is also a stream of income as well.
What's
I
the name of your podcast? What's the name of your
the name
podcast?
the name of my podcast, thank you, because sometimes I'm in multiple. It's getting to number two and the letter U, which is a healthcare podcast um um for those people who work in the public health realm, for people with people who have acquired HIV or are at risk. It also is for those who may be living with HIV and just want help navigating all different areas. We talk about a full gamut of things, but yeah, so that as well as always a production. So there's multiple things what I do. Always a production. I do creative direction for people who again are starting their businesses and just want to work on branding. They want to do a whole host of things but just don't know what their brand identity is. And again, when people hear me say image consulting, they think only clothes. Image consulting is a full gamut of things. And so it really just is again when you position yourself as an entrepreneur, how you want to show up, and it is just even the materials you use for marketing, the language you want to use, and I could go on and on about that. But yep.
Well, I'll be coming to you because I need, and since you're St. Joe's grad, I'm like, oh, I was my St. Joe's sister. I gotta
Yep.
go. I gotta go.
Yep.
I need
Yep.
I need some help with that. Because no one teach you to be an entrepreneur. They don't teach you. You have a passion. You say, let's start. But then you need help. You need help,
You do need help.
to craft that.
You do. I think one of the things someone said that you know how like you throw baby showers for women who and men who are about to become new mothers and fathers. People should throw like business showers as well.
Man, I like that idea.
Yeah, I liked it too.
I like it.
And I'm fortunate to be among people who talk business, do business, and are willing to share what they've learned, you know, good, bad, or indifferent, with their community. And they're not looking for a dollar. It's just, you know, they want to have conversations about just growing our community, you know, because other communities that are not us, they've built themselves, they're established, and they are far more reaching with their business and community than we are, and we just need to keep growing
100%
together.
agree. 100% agree. So,
Yeah.
what's next for you, girl? What is next? What is
What is next?
next?
What is next? Well, I actually just got a promotion at my job. So I'm now over HIV care and prevention at the health department. So I just trust God to continue to order these steps. I really would love to expand the conversations about HIV prevention with Black women, and help Black women, again, move away from that risk conversation when we're talking about sexual health or sex lives, and just empower Black women to also get on preventative medications. Like, you know, we take vitamins and boost our immune system and all of that. There are medications that we can take for preventative measures for not acquiring HIV. And as Black women, we are amongst the highest rates, sometimes 8 times higher than our counterparts for acquiring HIV. So those conversations are not reaching where they need to. So I really want to have more hands-on um, in just bringing that more to the community because it's lacking. I've been in quite a few projects around, and I'm speaking specifically about PrEP. So PrEP is a pre-exposure prophylaxis, and what that means is that you can take a preventative pill that would reduce your chances of acquiring HIV if you are having unprotected sex with someone who actually is already HIV infected. Now, it doesn't prevent you from acquiring gonorrhea, syphilis, or any STIs, but the chances of you acquiring HIV is significantly reduced if you are on that medication.
But still can. So
Yeah, the statistics of you acquiring, again, you have to build up that resistance in your blood over time with consistent intake of PrEP, right? But your chances of acquiring HIV are almost not there. But you can, if you are, you know, not protecting yourself, you can acquire any other STIs. I really want to do regular events around that for us, but yeah, we'll see what God does. Because
see
even
what
with the
God.
podcast, that's not something I pursued. They came for me. they came looking for me. So
Awesome. Awesome. That's wonderful. That's wonderful. So this is something I ask all my guests, okay? And I want you to, you're Jamaican, so you should have a bunch of them. What is one saying or proverb your parents used to guide or teach you a life lesson that you carry with you today?
oh, I just posted this other day. Oh my goodness. Oh my, every mickle make a muckle.
I can make a muckle.
Every mickle make a muckle. Meaning that every little bit counts, right? I in all areas of just how I live my life, even if it's just, developing, or just developing professionally, spiritually. I'm still learning as a mom. I don't care how old I am or how old my son is. The world is evolving, and any little bit that you can pour into yourself to be a better person, um, I also apply that every mickle makes a muckle to that too. And I also, it was just like, every little bit counts as far as like, how we fed ourselves or whatever, growing up. But I do apply that to just how I want to live my life.
That's amazing. Yes, I hear that all the time
Hmm.
from my grandmother, from Granny.
Yeah, I mean, also, I'm big on community, right? So anytime that we can work together as a community too, to chip in for those who need us, to show up for them. Again, any little bit that anyone contributes as a community, we can do so much.
Absolutely, absolutely, absolutely. I'm so glad that you're here with us. And I know this conversation, the audience will love this conversation because we have learned so much from you. Tell us, where can we reach you or find you or get more information going forward?
So I'm on all platforms. So professionally, I'm on LinkedIn, Peta-Gaye Tomlinson. I am on IG or Instagram at I am the Peta G. And Facebook is Peta-Gaye Tomlinson.
And then for Always a Production, where can they come find
Always
you?
Always a Production, same thing. You can find me on IG or Facebook at Always a Production.
All right, you hear it first. So, guys, thank you so much, Peta-Gaye, for coming through. I hope you had a great time.
I had a great time. I am so proud of you for even creating this space, because we need more spaces like this. I don't know much Caribbean people, pouring into, us like this. This was great to talk about what we're doing, because I don't think we do this enough.
Thank you so much. Well, thank you for coming to the studio. I like Money 365. Remember, until next time, keep your money irate. Bye, y'all.